Welcome back. My next guest is Dr. Owen McGonigle, who is an orthopedic surgeon with Bluegrass Orthopaedics. Welcome.
Thank you.
Now, one of your interests is sports injuries, and I led the show off with the ACLs. That's one of the big injuries we see. Before we get into the ACL, give us a little bit of an anatomy lesson on the knee.
Sure. So the knee is made up of the joint between the femur bone and the tibia bone, and there are several ligaments that span that difference to help stabilize that joint for us. ACL is probably one of the most well talked about and known injuries associated with the sports a lot of times, which helps prevent translation of the tibia bone moving forward. PCL lives in the same area right next to the ACL and protects the opposite with tibia bone going backwards. There's also stabilizing ligaments on either side of the knee, the MCL or medial collateral ligament, and then the lateral collateral ligament, which is part of more of a ligamentous complex on the outside or lateral side of the knee.
So we talked about the ACL. That's one of the big injuries. Tell us what happens when that occurs.
So most commonly these are non-contact injuries. Usually it's a twisting or a pivoting sort of maneuver that occurs during most commonly sporting events, but can be during everyday activities as well. And typically that force overloads the ACL and causes it to rupture.
So it gets your knee gets unsteady?
So it will be unstable depending upon the extent of injury, and it can be isolated to the ACL, or even other ligament injuries can occur if the force is enough. But the job that the ACL is supposed to do when it ruptures then no longer functions, and we can have instability of the knee with everyday activities or even trying to return back to things like sporting events.
Well, so if I injure my knee, how do I know that, man, I may have an ACL, or what are some warning signs that I need to come see the doctor?
Most commonly, we see right away people know that something happened a lot of the time. Some people will feel that they heard a pop or felt a pop even in the knee. And most people don't feel like they could go back in, if they were, say, for example, participating in sports, go back to playing in that sporting event. Commonly within an hour or two, the knee becomes very swollen. Anytime you have a very swollen knee, that is a big red flag that you need to go something done. It's not something that I would ignore. The most common thing is that an ACL might be torn in that situation, but there are other injuries to the knee that could represent, but it means that something is wrong in there. Less commonly, some people don't have those symptoms and feel like the knee gets back to normal fairly quickly, but if there's feelings that the knee just doesn't feel right, or feel like it gives out easily, or you just don't have the ability to kind of return to that normal level of function, that would certainly be another reason to have the knee looked at as well.
Now we watch football games, the guy's injured and the trainers out there trying to pull on the knee.
Yeah.
Can you tell by exam if you've got an ACL?
You can. There's a couple different exam maneuvers. The one, you see the trainers out there, what they're trying to do is just to reproduce what the ACL is supposed to do, and they're trying to pull the tibia bone forward and see if there's a good stop or an end point there. Actually, the easiest time to do it is right initially afterwards. A lot of times if the knee becomes big and swollen, the exam gets harder because it's painful and your muscles around the knee start protecting, and so. But there are some good exam maneuvers that will at least give us a clue that that's what we're concerned with, and then usually we'd want some additional imaging to kind of confirm that the diagnosis is.
And that
there.
Imaging is?
So MRI. So we always get an X-ray because sometimes you can have things like breaks around the knee if the injury has been bad enough. But an MRI shows us the soft tissue structures, in which the ACL is a soft tissue structure, and so we need that extra imaging to really know for sure that that's what was injured.
So you're a sports player, you injure your knee, you get the MRI, you've got a torn ACL, they come see you. What do you do with them?
The vast majority of these we're going to recommend surgery for. The ACL, particularly if someone's looking to get back into athletic sort of competitions, without the ACL, it's going to be very difficult, and they're going to feel like the knee is unstable returning back to that. Not only that, we worry about other injuries developing in the knee. If the knee is unstable and it continues to give out, you can develop injuries to cartilage, meniscus, which can cause future problems potentially. So surgery is the most common recommendation. There are a certain subset of people who are maybe less active and don't desire to go back to those activities, and we might trial a period of non-operative treatment. But usually those are people that are past days of doing recreational sports or competitive sports.
So if you get a surgery, you do it laparoscopically, do you have to open them up, and what's the recovery time for that?
Yeah, so it's predominantly done through the scope. Typically we have to harvest a graft, which might include another incision in the knee. And that's used to, we typically can't repair it. We have to reconstruct the knee, so we have to take other tissue and put it back in and basically try to do the job of what the ACL was doing. Recovery-wise, it's a prolonged recovery. Most people don't return back to sports for almost about 9 months after the procedure, and there's quite a bit of physical therapy and rehab and strengthening that goes into the recovery process, and really we look to see that patients have recovered their strength and their ability to do those activities that really stress the knee and the ACL before we say they're officially cleared to go back. But it's usually quite a bit of a time period.
What can you do to prevent it? Is there any certain things you do so you don't tear your ACL?
Yeah, there's certain training things we can do to try to strengthen the muscles around the knee, and in particular try to coach people how to land and cut and pivot better. There are certain positions that we call higher risk positions of the knee, and certain athletes, particularly female athletes, tend to be at higher risk because of the way they're, among other reasons, but some of their anatomy and how they tend to land and how they tend to fire certain muscles, such as the quadriceps more predominantly. And so there are things that we can do to try to teach and educate how to land and how to try to position the legs in space. Now, they're not foolproof, and you can certainly still have an injury without them, but we have been able to show that some of the risk of ACL injuries can decrease if we're able to kind of go through that education process and hopefully even start that at a relatively earlier age, and kind of get it ingrained at as a young athlete. So.
That's great information.
Yeah.
Thanks for coming in.
Thanks for having me.